my name's Nate Cohen. I'm originally from Cleveland, Ohio. I studied neuroscience at Brown University, and then I got my medical degree at the University of Virginia. I then did a residency in general pediatrics and fellowships in child neurology and epilepsy at Children's National. I'm currently an assistant professor of neurology and pediatrics at the George Washington University School of Medicine, as well as a child neurologist and epileptologist at Children's National in Washington, D.C. So my main research interest is in study of pharmacoresistant epilepsy and improving its treatment, and especially the surgical treatment. So the study population is children with focal cortical dysplasia, and our project is called Defining Pharmacoresistant Epileptic Networks in Pediatric Focal Cortical Dysplasia. And this project is really an extension of a previous study that we've done where we identified a large cohort of children from an imaging database with cortical dysplasia, of which about 80% developed epilepsy, and 2/3 of those kids have pharmacoresistance. Children with pharmacoresistant epilepsy often benefit from surgical treatment, and there's often in the literature a long delay between identification of epilepsy and the ultimate surgery, which can be curative. So this study is looking at imaging characteristics, both structural and functional, of children with FCD and pharmacoresistant epilepsy. And so the first aim is to try to look for an anatomical co-localization of the dysplasia with a distributed functional network. That is, we take the dysplasia on an MRI and sort of see if it overlaps with one of the 7 typically distributed cortical networks, and try to see if there's an association between this co-localization and the development of epilepsy. Based on preliminary data, we hypothesize that FCD co-localization with the default mode network may be associated with development of pharmacoresistance. Then the next stage of the study is going to look at functional measures and create functional connectivity maps or altered connectivity maps of kids with pharmacoresistant epilepsy and compare them with normal controls. And we hypothesize that the most abnormal connectivity will be with the dysplasia and its network of residents, compared to normal kids who have just normal, typical connectivity profiles. So I had the benefit of starting my training at Children's, and I was in general pediatrics. I became really interested in epilepsy because we're such a big epilepsy center. I actually started working early on in my pediatric training with Dr. Guyard, and that's when I sort of made the shift to become a child neurologist. And fortunately, I was able to switch and train at Children's National. But really, every day as an epileptologist, I'm thinking about or interacting with children who have focal cortical dysplasia and its related epilepsy, as well as their family. And so helping them is my ultimate motivation. First, I'd like to thank the Child Neurology Foundation and the Pediatric Epilepsy Research Foundation, as well as the committee, for selecting our project for the Shields Award. This is an unbelievable honor. I think that this project has the potential to help child neurologists better identify early candidates for surgical resection. As I said, there's a long delay often in kids with dysplasia and its related epilepsy, and the time that it takes for them to get to surgery. So it's shown that earlier surgery can improve both seizure outcome, but as well cognitive and functional outcomes. So we're trying to lessen that gap. And so we hope that the results of this study may help us better identify these kids. Finally, this project is going to allow me to learn more advanced neuroimaging techniques that I can apply more broadly to studies of pharmacoresistance and network effects on epileptogenesis in the future. So thank you so much again for this incredible opportunity.